And school holidays, I would go and stay with her and her family in Kampala. And it was during those holidays that I met occasionally Olinka, who is Muna's cousin. At the time, I don't know if Olinka remembers this. And then recently, a mutual friend of Muna and I was recently diagnosed with breast cancer. And Muna immediately said, you need to meet my cousin Olinka. She is doing amazing things. She's so inspiring. She has an amazing story. And she sent us a link, and I watched Olinka share her story with a panel of other speakers. And I immediately thought to myself, this is something that we need to share with our Girls for Girls community. And so here we are today. So without any further ado, Olinka, the floor is yours. Thank you.
That's okay. Hi, guys. Can you hear me?
We can hear you.
So I'm actually going to switch, use my phone so that I can, you guys can see me. So, Stella, I'm going to have to log out and log back in, okay? Okay. Can you hear me?
We can hear you. Hi.
Hey, guys. Hello, hello, hello.
And we're here.
Hello from Los Angeles, California. That's where I'm at. That's where I live. So hello to everybody. Thank you so much for joining this great conversation. As I was introduced, my name is Olinka Rubadiri. Sorry? Sorry, did somebody ask a question?
I think maybe everybody must mute while you're talking.
Okay. Okay. So again, sorry, I was having some technical issues with my laptop, so I'm using my phone until I can get that fixed. But in the meantime, I will introduce myself again. My name is Olinka Rubadiri. I'm originally from Uganda, and I was born in Uganda. I'm the last born of a family of 10 children. My father is a very well-known literary and poet, and a teacher, a poet writer in East Africa, David Rubadiri. And so my story I will share with you. I'll try and make it as brief, but with a lot of meat information for you all. I moved to the United States in 1990, and I was 20 years old, came to go to school. And at 37 years old, I found a lump in my breast on my birthday. It was on my 37th birthday, unfortunately. I happened to just be lying down on my bed and noticed that my breast had a little hump in it. I didn't really understand what that was. And so I went to see my physician about it, and immediately having to have a what they call just a regular physical breast exam. She referred me to go and get it furtherly looked into. So I went to the oncology area of the hospital, where they perform what we refer to as a mammogram and ultrasound. And during the tests, they did notice that I had some masses in my left breast. So we got to biopsy those, and a few days after that, we got a diagnosis of a stage 4 breast cancer. Now, if a few of you know, cancer comes in stages, minimal stage to 4th stage, which is very aggressive. So my type of cancer that they found was in my breast and actually had gone into my lymph nodes in my left armpit. That's where the lymph nodes are. So immediately we had to get a team of doctors together to figure out what type of medication and course of action, as they call, in regards to treatment. Now with cancer, we all know chemotherapy is one of the treatments that we have. You also may have surgery. You also go through radiation. But because of the aggressiveness of the disease that I had to first start with chemotherapy. And that had me go through 8 sessions of chemo. That was 1 session a month. And as we moved on to getting these sessions, they would do preliminary testing to see how the tumor is actually responding to treatment. Lucky for me, it was responding very well. It was shrinking, and that was the goal. Shrink the tumor. Then after that, we would look into what needs to be done after that. So lucky for me, I did respond very well. 8 months I was done with my treatment and went to have surgery, which they refer to as a lumpectomy. So a lot of times you would hear people having a double mastectomy or choose to actually remove the breast that has the disease. But because I had responded very well to chemo, they decided to, okay, are we gone?
Yeah.
Okay, I'm sorry. I think I might be back on. But if this is better, I might just use my phone. Don't know. I'll just sit it over here. Can you guys see me well? Okay. Yeah, so I'm good. Thank you. So I had, yes, so the decision upon that was we're going to have a lumpectomy. So they actually just removed a partial of the breast, which is actually the area that had the tumor. And after that, I went through radiation and everything was fine. So we're talking about 2007. Oh, thank you very much, Miss Harriet. Thank you so much. So during, I'm going to kind of like break down and tell you what my experience going through chemotherapy in 2007 versus what we go through right now. The side effects and response to treatment at that time were pretty aggressive. So your side effects are nausea, unable to really eat a lot, body aches. As you can tell, I lost my hair. I had a big mop of red dreadlocks, and one of the symptoms is you actually lose hair. There's some treatments, actually, chemotherapy treatments that do not cause hair loss, but mine did. So 2007, finished my treatment in 2008. And then I had my full examination and they found that I was healed, which they refer to as remission. When you're in remission, it means that there are no signs of disease at that point. But I still had to go through preliminary testing every 3 to 6 months just to make sure that everything was, I was in a safe zone as far as in being in remission. Now we're talking about 2008. Now, unfortunately, in 2010, I relapsed, meaning during one of my preliminary tests, we found that the mass had come back into my breast and unfortunately had spread into my liver. So then we go back into course of action and say, okay, now what type of cancer is this? Is it the same in both organs? And how do we treat it? So the wording that they use whenever the disease spreads into organs, it is metastasis. It says, they use the words as it has metastasized. And that's what cancer really does. It metastasizes to organ by organ. And so for me, at that point, it was like, okay, aggressive kind again. We need to change the type of medication maybe and get me into a stronger type of treatment. So I had to go through, oops, hold on, my lighting here. I had to undergo again a different type of chemotherapy. And I had, again, 8 sessions. But unfortunately, during the 3rd session that I had, I was not responding very well to chemo. So they had to change it. And upon doing some tests, they found that the disease had actually gotten into my lung. So now you're talking about breast, liver, and lung in one role in like about 3 months. And we're trying to figure out now, what are we going to do? So as we try and figure out the best type of chemo that I would respond to, we found a good one. And they put me on that session again for 8 months. I had to go through that. I responded very well. All tumors shrunk. All tumors disappeared. And I did not need any type of surgery. However, I chose at that point to have a double mastectomy. And the doctors did agree because of the type of aggressive type of cancer I have. We agreed upon me having a double mastectomy. So once I finished my chemotherapy treatments and we found that the disease had gone, I had my surgery. However, I was advised that I would have to continue chemotherapy the rest of my life. Now we're talking a span of 2011, 12, 13, 14. I had my surgery in 2012. So every month, guys, I had to get up once a month, go get chemotherapy. It was a very difficult season because also the time I wasn't working. And yeah, not easy, Miss Yolanda, not easy at all. I wasn't working. I was single mother and trying to figure out, okay, what does life look like for me at this moment? So I put my best foot forward. And I decided to get up and I said, I'm going to try and find a job that would allow me to balance myself as far as getting my treatment, but also try and financially support myself and my child. Now, in the course of all this, you're talking about 2007 to 2014, give me 1 second, guys. I'm trying to, okay. I have my aunt who walked this journey with me when I started in 2007. Her name is Auntie Philippa. She's actually trying to join the meeting and having some problems with her device. But I wanted to introduce you guys to her because she is a plethora of information. She herself went through breast cancer earlier on in her life. She's a cousin of my mother. And so when I got diagnosed, I was introduced to her. And she's the one that held my hand. She's the one that actually empowered me. And the empowerment starts with knowledge, the power of knowledge. Once you know exactly what it is that you're dealing with, you then are guided with the strength. For me, number one, I have to say I'm a Christian. I know God loves me. And I had to trust that his word says, I am healed. His son died on the cross for me and you and anybody else that is handling life very difficultly with any types of diseases and issues. So I put my best foot forward as a Christian and believed in that. And I firmly believe that with that type of positive energy, we're able to endure a lot, right? We're able to endure obstacles along the way, whatever it is, because we're warriors. We're his warriors, we're his children. So for me, that was my number one. I have my church family, my personal family, my friends who hovered over me. And what I did mostly is learn how to educate them through the process of my illness, right? Educating is whatever I was told by my physician. I read about it, asked questions, and then passed on the information to my family, who then were able to internalize and see how they could support me. So just going back to sharing with you, I was very lucky, and I'm very lucky to live in the United States of America because the healthcare system here provides all that support. Now, as an advocate, I was really challenged and given the opportunity to share my story with my family and also my people and my community in Uganda. And that's how I started my movement, with the knowledge that Auntie Philippa taught me is sharing information, is us supporting our community in learning about this disease. Now, where am I in my illness, and how do we move forward as a community in sharing this story? In 2014, 2015, 2016, I am actually going for chemotherapy every month, guys. 2016, before I went home on one of my events and my journeys as a philanthropist, I sat down with my God and I said, listen, Father, I think I need a break. I'm going to stop this treatment and I'm going to trust that you have healed my body. I'm going to be obedient with learning how to take care of myself, which is eating well, taking care of my mind, my body, and my spirit. And also with the help of my doctors, going through my tests, my imaging, and making sure that we were able to move on forward. Guys, I sit in front of you telling you that I walked into my doctor's office in 2016 in September. I told him I'm going to take a break for 3 months. I will come back, we'll do my tests, and we'll look at how my blood work looks. If we're any growths and new tumors, then we go back and have treatment. I'm sitting in front of you telling you I have not had a drop of chemo in 9 years. 9 years. And that is me understanding how to take care of myself, how to advocate for myself with all the knowledge that I have. And now, what is my job is to share my story and to encourage anybody that may be walking through this, especially my community. It's very concerning to me that our health system and our healthcare in Africa is really suffering. But it's people like myself, it's people like my stories that may share and give hope and courage to those that may want to give up or may feel that they're helpless. There's so much information out there, guys. We live in a time right now where the internet is there. It's so much information, right? We just have to hover over each other and encourage each other to see how we can empower our community. And it's people like Auntie Philippa. I'm hoping if she's able to be on the phone, on this meeting to share. There's also a very good family friend of mine, Shiba Hakiza, who is on the call right now as well, who is part of another ministry in having to help with the healthcare systems. And Shiba, if you're on, I will maybe give you an opportunity just to introduce yourself and let the folks on the meeting know exactly what it is that we are doing in regards to supporting healthcare systems. I will also answer any of your questions after we get past Shiba speaking, and then I can share exactly what it is that I did and everything else. So maybe Shiba, you on?
I am. Can you hear me?
Yes.
Okay. So I actually am on first of all, good morning, good evening to you, Olinka. It's after midnight in LA. So I'm actually based in the US, but I happen to be in Kigali right now. So very glad to be home, enjoying the blessings of family. And also, I'm glad to be with you women. Thank you, Sheila, and Girls for Girls, for the work that you're doing. That prayer was so beautiful in the beginning. I love that. If you don't mind, I will steal it so we can use it. But Olinka is a true warrior. She's my sister, and I have so much love for you. I am so honored to see how you are so resilient through your journey, and you give us inspiration every single day. So Auntie Pink, as we call her, Auntie Philippa, is actually with me on the phone since she can't get into the meeting, unfortunately, for you to see her beautiful face, but she's a 30-year breast cancer survivor. We've been together for the past 2 days, and we have been doing some great work to see how we can utilize innovative technologies, AI, and others to be able to bring better quality healthcare in the area of breast cancer screening and accessibility using remote care. And so I actually work with Hippo Technologies, and it's a biotechnology company that offers telemedicine. And Auntie Pink, if you are able to talk, you can at least say hello, maybe speak to these beautiful women that are on the line with us. And then I will talk a little bit about the work that we're doing. Are you able to say something?
Well, I don't know. Can you hear me?
Can you hear her?
Can
Okay,
you hear
yes.
me?
Yes, they can hear you.
Yes.
Links.
Yes, Mama.
Well, I Olinka links, and I'm so happy. Every time I hear a testimony of a journey, it just refuels my passion to even do more than what I do. Links, Sheba is here in Rwanda, and you just have to wait. I don't know whether she can show some of
Yes, I'll do that.
Yes, when I am beyond my flows. Now, I think you have told me that you're a survivor, but my focus now is the awareness and empowering women and inspiring them and giving hope. There is nothing bigger that you can give than hope. And that's why one of the first books that I'm writing is Dare to Hope, because once you dare to hope, everything is possible. So, what I can say, Links, what do you want me to say? I think you have said everything.
So
Yeah,
maybe
so,
you can also start, I'm sorry to interrupt you, Olinka. Maybe you can talk about BCIA, Breast Cancer Initiative East Africa, that you started this organization about 15 years ago. And I can try to share some of the pictures and videos. I'm just waiting for that to upload so that they can be able to see the beautiful house that you have built to care for women. But BCIA, maybe you can tell them about that.
Well, actually, BCIA is a family affair because as the Sheba speaks, her mother, the 4 women I met with when I dreamt about having this initiative that was supposed to make a difference but in the US, she actually was the executive. What we do is we do breast cancer initiative. Support, research, the survival.
Auntie Philip, I think we're losing you.
How
I think
about
we're
now?
losing.
Can you hear me?
Mhm.
Okay, try again now.
Did you hear all the things we focus on? Or can I just
Is that better?
summarize?
Yeah, that's much better. Yeah, you can
Okay.
continue.
Yes, so we work with women and we work with women and we work with the youth. By the way, Rwanda, just like all the youth, to focus on 70% of the population in Rwanda. People who are
Shiba, I do apologize, but I don't think that we can hear Auntie well.
Okay.
And so
Let me speak. Yes, that's fine. Okay.
Yeah, Sheba, I think after all you just you know you have that information.
Okay, I'm putting the website and also the chat as was requested. Okay. And a few. All right. So Unfortunately, we're not able to get that, but if you go to that link, it is Breast Cancer Africa. That is the actual website. And what Auntie Philippa was mentioning is that 15 years ago, herself and some other women, including my mother, helped to start this great organization in Rwanda. And so I'll just share my screen so that you can be able to see that. And then I'll also tell you about what we're doing here. Okay, does everybody see that screen?
Yes.
Okay, wonderful. All right, so Breast Cancer Initiative East Africa is actually a 501c3 nonprofit organization that is based in the United States and in Rwanda, Kigali. And what is being done in Rwanda is truly remarkable. Auntie is educating women all over the country. They have done breast cancer screenings at events for anything from banks to hospitals to schools. People know her as Auntie Pink, and it's because of the tireless efforts of her and her team. Every year there's an Olinzi walk that happens during the month of October during breast cancer awareness. If you see my the background of my picture, it says that 1 in 8 women are diagnosed with breast cancer every minute. So we want to be on the front lines of being able to help with prevention. And that's exactly what is being done here. Yesterday and the day before, I had the opportunity to go to the Pink House. And that is a beautiful place where women who are going through cancer treatment, let's say they're coming from an upcountry rural area where maybe they're not able to commute back and forth to the city, they're able to go and sleep there, have food, have, you know, basic upkeep. And right now she's only able to accommodate two women at a time. And so what we would like to do is get that to at least 8 through the expansion. But also at the Pink House, you'll find educational materials, you will find resources about breast cancer. You'll also find that there is a workshop where they make different items that are able to be sold, and that is where they can be able to raise money for the organization. So I visited yesterday, and I want to see if it's able to, if you're able to see my video. Okay, here it is. All right. With the incredible Auntie Pink, also known as Philippa Dikwi Chibugo. I am so glad to be here in Rwanda to see this great achievement of the work that you have been doing. Can I enter the house?
Yes, Miss Diva. The goals and objectives and the logo. You see this woman?
Yes.
By the way, in her basket here, she's carrying ignorance, poverty, and disease. And I'm hoping that before I exit, we
supporting women when they are needing help from treatment.
Yes, we do information dissemination to people who want to learn about the disease. Then we also support the ones who are going through, and we also support the ones who have gone through. We have a breast cancer survivor support group, and tomorrow we are having a group coming in to learn about financing and what, giving them hope that there is life after breast cancer.
You can see everything, right? Now, if you wanted to record video, you would say record video.
Record video.
The light comes on, so it's illuminated. If you're doing it at 5 degrees of zoom, or if you're at 1,
So the doctor can be able to see the patient at the highest level of enlargement. If they want to hear bodily sounds, this is where we would be able to. You as the clinician, the healthcare worker that's with the patient, you would put the stethoscope on them. This would be connected to a tablet or a phone, so that the doctor who would be remote can be able to hear clearly all of the bodily sounds, the heartbeats, whatever they need. Yes. And so we want to be able to bring the best quality care to Rwanda from wherever it can be accessible. And so we're really excited about that. Stop recording.
I have patients who wait 6 months or even 4 years.
Wow.
Can you imagine what this is going to be?
We are going to be able to have game-changing results and saving lives, really, because by being able to have community health workers, people who are not, clinicians, to see these women using the virtual device, we give them access to providers that they didn't have before. So you purchase items, right? And those can be used for fundraising efforts.
Yes.
$50,000 US to be able to have 8 women to have the necessary care, support as they're going through chemotherapy.
And it wouldn't even just be for the 8 rooms, because we'll have more now with the hippo. We'll be able to use our nurse.
Yes, absolutely. Yes.
Be one of the centers for doing this and then referring out.
Absolutely.
All right. So that is the pink house. Let me stop sharing my screen. Okay, ladies. So there is so much work that needs to be done to help more women. If we could have pink houses all over Africa, it would be incredible, right? She is empowering women because they are learning how to use papyrus, to make like different crafts. There are things like shoes that are being made from those loofahs, picture frames, so many different things, just beautiful decorations, bags, utility things, and that also empowers them. We also want to be able to make sure that more women are able to come to the Pink House for comfort, for refuge. And so, as you saw in the video, with the device that Auntie Pink and the other young ladies who's a nurse were wearing. This is a headset that would be worn by the, trying to see because I'm looking at myself, would be worn, and this part of it goes right below the eye. And so the nurse or the healthcare worker, they would be able to connect remotely so that the doctor would see directly exactly what the nurse or the healthcare provider, it doesn't have to be a nurse. We're looking at being able to bring these type of devices to community health centers throughout the country, community posts, which just have people with 6th grade educations that are able to do things, simple things like temperature readings for malaria, being able to help them with dispensing of basic medications. The device also connects to a stethoscope that allows the doctor to remotely hear the bodily sounds. So if we have a woman who's come to the Pink House for care, they have complications, instead of immediately calling an ambulance, rushing them to the hospital, since we have a nurse that is working at the Pink House, they can be able to do initial assessment, use the Hippo virtual device to be able to connect to a physician remotely, an oncologist or just any other doctor who can provide guidance. And then we can reduce the expense, travel time, and work more efficiently. We're also looking to partner with another company that offers a portable handheld ultrasound device that we can be able to do screening for women for breast cancer for prevention. So the more we can screen, the more we can get exposed to the knowledge, then we can truly make an impact, right? The survivorship amongst Caucasian women is much higher than Black women. At least in the United States, 40% of Black women die at a higher rate of breast cancer than Caucasian women, and largely because of diagnosis is not happening until it's much later in the woman's life, and so I mean in the cycle of the disease. And so we want to be able to do that using innovative technology. So there's a lot being done here in Rwanda. I'm very grateful and privileged to see how we can build relationships, obviously with the Ministry of Health and many other great partners, such as Auntie Pink and the Breast Cancer Initiative East Africa. So please visit the website. If you are able to donate to the Pink Wellness House so that we can expand and we can get better access to women for cancer care, treatment, and prevention, it would be so much appreciated. Thank you, Sheila. Thank you, Olinka. God bless you all, ladies.
Thank you so much, Sheba, for sharing with us. Auntie P, you can see she's indomitable and she's doing such great work. And we really hope that, it can spread to the other African countries. I'm going to go back to Olinka. Olinka, I don't know if you want to finalize your story, and then we'll give an opportunity for anyone who'd like to ask questions. I know there was a question about your diet, the food that you were eating post stopping chemo. So maybe if you just want to, if you want to just round off your story, and then the floor will be open for anyone who has any questions. Thank you.
Sure. So I just wanted to kind of like go back and kind of like give a little summary on things that we need to pay attention to as women during our process. Prior to, as you know, as you turn 40, they usually say at 40 years old is where you need to have a mammogram. Prior to a mammogram, we're responsible to do a breast test on ourselves. This is something that, I'm sure a lot of us, when we go to our doctors and we have our physicals, they always tell you, make sure you do a self-examination. So the symptoms and signs of breast cancer for mine, by the way, I had no signs, I had no symptoms, no pain, no nothing. And it's very common to know that sometimes cancer is a very silent disease. I'm sure you've heard of it. They say it's a silent disease. It does happen. No signs at all. So we have to pay attention to lumps, any pain, any discharge from nipples, any size difference, if you notice anything. Those are the things that you really have to pay attention to and bring up with your physician if you notice those changes. This will definitely help with prevention. Now, for myself, as I shared with you, with no signs and with no symptoms, even further on, I didn't have any symptoms. So the most important thing that I found for myself was having conversations with a doctor. And Auntie Philippa always uses this: knowledge is power. Knowledge is power. The questions, if you don't know what to ask, it's good to get in touch with your family, sit down and kind of like jot down what you guys may think. And then also having family members go with you to your doctor appointments is very important, because you might miss something. You as a patient may be so worried and concerned about what is going on with you that you might miss a lot of important information. So it's I encourage people not to be shy, to take family members or a friend that you can trust enough to know that will hold your hand and get all the information. And then it's very important, again, also to have these conversations on the dinner table, and be able to have the conversations about family health, genetic issues, right? A lot of times we don't even know what our grandparents maybe passed away from. And in our African community, we don't have these conversations. A lot of these diseases are called taboos. We consider them taboos. But we need to try and really educate and empower children, sit down with them and have these conversations. So I know you guys have a lot of questions for me. One of the questions that I saw here was about what I ate. So what I got to learn about was a lot of what we refer to as organic food or plant-based diet. And if you actually can Google it, it's actually one, being able to just go back to the basis of us eating our grains, staying away from a lot of foods that have a lot of fat, a lot of sugar, a lot of preservatives. As you know, our grocery stores are pumped with foods that are prepackaged and have a lot of preservatives. We need to avoid those foods. We need to go back to our gardens, like Auntie Philippa has that wellness garden. Very important to educate ourselves to eat better. Instead of buying our juices that are again loaded with a lot of sugar and preservatives, make your own juices. So what did I do? That's how I just changed my diet. And a lot of exercise, a lot of meditation, a lot of self-love, I should say. But I hope I answered that question in regards to how I changed my diet.
Olinka, there's another question from Betty. Reflecting on your experience, what are some ways family members can best support someone facing a new cancer diagnosis?
Yes. So again, as I noted, we all have a different characteristics. And so I feel, as far as family support, the conversations, like I mentioned, in regards to the education that you get from physicians, right? It's very, I think it's a strength that actually will come from a patient enough to take one family member, again, who would be able to articulate to everybody. And once you get that support and hover around each other and start talking, it creates a strength within the family. And so my encouragement and what I advise for people to do is, as a patient, the fear is what is going to kill you, number one. Fear is going to kill you. And I'm being very honest about that. So you have to get a little courage within yourself, reach out to somebody like me who has been through things like that, and help support the family by bringing somebody like myself into your family, right? To sit down and, again, answer those hard questions. Because once you start to speak to somebody who has actually walked it, it's easy for you to actually see the strength that somebody may have. And that's something that I really thank God that He's actually given me the strength enough to share my story. It may be scary, but along the way, the challenges make you stronger. You become courageous, you become hopeful. And when you see somebody like myself, you then can see yourself in the journey that you are walking. So support groups, I feel, are lacking in our community. And so that's something that I personally do, is when I go home, I make it a point to go to our secondary schools to talk to students about breast health, boys and girls, by the way, because men also get breast cancer. So we have to also pay attention to that. Our boys need to also be educated enough to know how to support their sisters, their mothers, their daughters, and all that. So that's another conversation that is very hard for men to have and also understand how to support us. So support groups, I feel, are very, very important. That would help our community engage and learn how to deal with this disease.
Thank you, Olinka. Would anybody else like to ask a question or make a comment? And while we have Olinka here, let's make the most use of her. And or even if you have any questions for Sheba also. Thank you.
Yeah, and also, by the way, I'll leave my email in the chat and my phone number. If anyone would like to reach out to me, please feel free. I'm very open. I'm very open book and very encouraging. So anybody that needs assistance would like to talk through their journey, their questions, I will be available to help.
So hi, Olinka. My name is Joanne, and I have a couple questions for you. Let me start with what might be the simpler question. I have a 12-year-old, and she's now getting boobs and, not knowing what to do with herself. So to say, what is a good age to start speaking to the girl child about this without scaring them, but kind of getting them in the habit of understanding? I unfortunately, luckily, I've had 3 breast lumps removed myself that have been benign, and I want my daughter to be in a position where she's aware and doesn't have to go through the fear or lack of knowledge, so to say.
Mm-hmm. That's a really good question. So for me, knowing what I know now, I think for me, the conversation has to start with puberty. And this is when I think when your daughter, any girl, starts to menstruate, right? Because when you have that conversation, you're going through body changes, right? The breasts are going to start to, grow, and a lot of our girls these days, they get really voluptuous, really at young ages, right? So for me, I think the conversation should be had at that stage. Now, my child is a boy. When I lost my hair, I do remember I was trying to figure out how am I going to have this conversation with my son at the time. Also, I was married at that time, so I also had stepchildren, and one was a daughter. So I remember dropping off my son at school one day, and I dropped him off, and when I went to pick him up, he was crying. And I was trying to find out what had happened, and everybody was teasing him, telling him that your mom's a boy, right? So I was like, I'm going to use this opportunity to try and figure out how to help these kids and understand what I'm going through. So I went to the library and actually found a book that actually educates children about how cancer grows. And it was actually an analogy as far as how weeds grow in our gardens, how beautiful a garden is, and how weeds can attack and kill. And then you have fertilizer that does this and all that stuff. So it was actually an education process. So answering your question and going back to the right age, I think puberty should be, right? And then also kind of like understanding and knowing the temperament of your child, knowing the kind of words, but kind of like look into getting educational tools for that age that they'll be able to understand what is going on with their body. And then, of course, you start to do the self-examinations. A lot of our kids are going to boarding schools, so that's a very important thing to actually talk to the schools and make sure that the nurse is engaging with the girls during the time when they're in school, right? Because I know when I went to boarding school, that conversation was never had. So I hope I answered that question for you.
You did. Thank you. And I think it helps a lot because I have another daughter. So I want to be able to set, a routine, so to say, in that regard. So my second question is a bit more around the emotional side. When you had your double mastectomy, you understood the why, right, of what was going on and why you were doing it.
Mhm.
But how did that affect you emotionally, and how did you overcome that?
So I think for me, once I got to truly understand what the disease does internally and how these tumors just tend to just grow at a massive rate and do whatever they want to do, right? I had to then recognize that the healing on the inside, um, and the way it affects my physical, I guess, my as women, as we know, it's our breasts, right? And so as a woman, I know it's a huge loss for us, right? But for me, I always was thinking about my health. I'd rather be healthy and be cut and diced and sliced as opposed to being vain about what I looked like. It's now that for me emotionally started with my hair. When I lost my hair and I looked at the reality of this, it was actually what strengthened me. Then, as I got to read women's stories and look at all the different types of surgeries, I educated myself with the types of surgeries that happen, the types of choices you can make with your double mastectomy. Like for me, I ended up having a double mastectomy and I got implants. There's some women who don't want to have those implants. And so, how do you deal with just having nothing, right? So, it's a personal decision with self, but it should not be a vain one. Because I will share with you, it is going to be a journey for the rest of your life, right? Like I mentioned, I've had breast, liver, lung. I've had a lot of surgeries. I had to get, you know, ablations here. All these little scars that I have became, to me, they became my warrior patches, right? And I started to look at them as my strength and my courage, and knowing that they don't define who I am in my heart and who God has really placed me into this as what my purpose is. These scars are the same scars his son had when he went on the cross and died for you and me. Did you see how they beat him to death? But it didn't change him because he knew where he was going, right? As a Christian, that's how I see my life. That's how I encourage myself. That's how I encourage another person to not look at what the scars may be, but what it is that they build in you and how they will affect you and your strength to be able to move forward in this journey. So that's how I would encourage somebody to look and make those decisions about saying, yes, it could be painful, but those scars are your warrior patches, and wear them proudly. Wear them very proudly, because you're not the only one, and you will encourage somebody else to do better with you and for themselves and for somebody else that will come forward.
Olinka, thank you. Thank you for your time and answering the questions. It is
Yeah,
a blessing. Thank you very much.
thank you. Thank you.
Thank you, Joanne. Does anyone else have any questions or comments, or even if you want to share a story, an experience that you've had, now's the time. Barbiria, are you trying to ask a question? No. Okay, so maybe, Olinka, before we close off, maybe you'd like to share some of the work that you've been doing in Uganda?
Yes. So, like I mentioned, at the beginning when I went home the first time, and I really wanted to try and figure out how I can support my community. Again, I went to the hospitals, and it was just a sad state. And my little me, I don't have the financial ability to be able to change that world. But I found that, again, the educating and going back to schools. So I started, I was invited to my niece and my nephew's schools to speak to the kids. And once I started doing that, it just spread like wildfire. Everybody would just invite me to go and speak. And so the work that I do is actually going to speak to kids, the knowledge, giving them the resources that I'm learning that, again, are in East Africa, like what Auntie Philippa does, very important. I also go to businesses and speak to the women during their break or lunchtime hours. I have a few sessions that I have with a friend of mine who has a clinic. And so we will meet, we'll schedule time and let everybody know I'm in town. And so pretty much that's what I do when I go home. I make sure that I touch one or more schools as I go on, and hopefully these messages will be well received.
Thank you, Olinka. Yeah, thank you so much. As we mentioned, it's about midnight in California at the moment, and I know that Olinka was up at 4:30 her Friday morning, so it's been a very, very long day. Thank you so much for your time, for sharing your story of faith and resilience with us. It's very, very inspiring, and hopefully the message you have shared today, Sheba and TP, will encourage someone to go for a mammogram, to get checked, or to speak to people around them and just share the importance, because early detection is key, as we all know. So if nobody else has any questions, I'm going to close off. Thank you so much, Olinka. Thank you, Sheba. Please give our love to Auntie P. We love these aunties so much. They don't know how much
Yes,
they make an impact in our lives. And I'm wishing everybody a happy Saturday and a beautiful rest of the weekend. Thank you so much.
Yeah,
Karabo.
guys, just I put in my phone number and my email. So please, like I said, reach out, share with anybody that might need an encouragement, a holding hand. I'm definitely here to support anybody that needs it. So Sheila, thank you so much for this time. I really, truly appreciate what you're doing. And we shall change the world together. Sheba, thank you for being on.
Amen.
Thank you for the information that you have shared. Everybody who has taken time out to come and listen. I look forward to more of what we're doing right now. God bless you guys and have a wonderful weekend. Bye.
Thank you.
Thank you. Bye.